A very good afternoon. Shri Rohit Chadha ji, CEO and President Times Network, distinguished members of the medical fraternity, all the eminent guests, participants, speakers, ladies and gentlemen, it's my immense privilege to join you all for the Times Network India Health Summit and Awards 2025, a platform that unites policy makers, healthcare practitioners, industry leaders, innovators, media, and everybody together around one shared goal, which is health for all. And I truly value this opportunity to share my government's roadmap for building a healthier and a stronger India by 2047 as India completes 100 years of its independence. Friends, the aim of my government is to provide universal health coverage, ensuring affordable, accessible, and quality health care to all our citizens. And in the past 11 years, our government has actively pursued this goal to attain it by 2030 as part of UN SDGs. In the past 11 years, healthcare in India under the leadership of our Prime Minister, Shri Narendra Modi ji, has undergone a profound transformation. We have made a transformative shift in our approach towards healthcare. So today, healthcare is not just curative healthcare, but today, healthcare is comprehensive healthcare, and that's the shift we have brought about by rolling out the new National Health Policy in 2017. So we take care of every aspect of healthcare, from preventive to curative to promotive to palliative to rehabilitative and geriatric. That's how we look at healthcare today. And even the expenditure on healthcare has constantly been going up. So if I talk 11 years back, we were spending only 1.1% of the GDP on healthcare. But in all these years, that 1.1% of GDP has gone up to approximately 2% of the GDP. So we are steadily moving towards the goal of spending 2.5% of the GDP on healthcare as outlined by the new National Health Policy, which was rolled out in our government's regime. Friends, we have also tried to encourage the state governments, because public health is a state subject, so it's important that states also come together, join hands, and we've been encouraging them to enhance their budgets which they spend on healthcare. And that should go up to around 8%. And when states and center, everybody works together, we will be able to bring down the out-of-pocket expenses in India, which still remains to be a cause of worry. In 11 years, right from scaling up the medical education infrastructure, healthcare infrastructure, to providing financial protection to a large population, and to leveraging technology and digital innovations, we've been doing everything together. Just few days back, you read about the completion of 7 years of our flagship scheme, which is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Ayushman Bharat PMJ is not just a scheme. In 7 years, it has emerged as a social revolution. And why I say this is because Ayushman Bharat PMJ is today giving hope, today giving dignity to 62 crore vulnerable citizens of this country, which includes not just the poor, not just the elderly, but also the frontline healthcare workers and also the gig workers. So everybody is benefiting with a free of cost treatment worth 5 lakh rupees. So compared to the days when people would delay their treatment for lack of money, today Ayushman Bharat PMJ has given them a big hope, and that's why we call it not a scheme but a social revolution. And this Ayushman PMJ, coupled with initiatives like the Pradhan Mantri Jan Aushadhi Pariyojana, Amrit Pharmacy, Pradhan Mantri National Dialysis Program, the Free Drugs and Diagnostics Initiative, which is executed right from a sub-center or an Ayushman Arogya Mandir to a PHC, to a CHC, to a district hospital, which means all the primary and secondary government health facilities. And most recently, the GST 2.0, which brings a tax relief on 33 life-saving drugs, along with the health insurance premium. So all these efforts together have helped in bringing down the out-of-pocket expenses from 63% to 39.4% today. My dear friends, we have made a record expansion of medical education infrastructure in the country. Because shortage of doctors and specialist doctors and medical staff, that has remained a concern for long. So when our government took over 11 years back, we made a plan to scale up that infrastructure, and today, in 11 years, we have been able to increase the number of medical colleges from 387 to 809 today. The All India Institute of Medical Sciences have gone up from mere 7 to 23 today. And not just this, we are also establishing nursing colleges in co-location with all the new medical colleges which have come up. So when I talk about these efforts, it is just to indicate that in times to come, we will not face the shortage of doctors, specialist doctors or nursing staff. We have made arrangements to take care of their availability in every nook and corner of the country, especially the areas which are remote and far-reaching. That's the kind of spirit we are working with. And we know that over all these years, in the healthcare infrastructure which already exists, there are critical gaps, and those gaps were highlighted during the pandemic. And India wants to prepare itself today to face any future health emergency, any pandemic, any disaster. That is why we came up with another mission, the Health Infrastructure Mission. It's a huge initiative to fill up all those critical gaps and prepare our health system, give them the capability to be able to respond to any pandemic or any emergency in next few years. That's how we are preparing our healthcare systems today. And one must not also forget the massive impact of other initiatives which we have taken through different departments of Government of India. Constructing millions of toilets throughout the country under Swachh Bharat Abhiyan, or providing clean drinking water to our citizens who still don't have access to clean drinking water. Providing clean cooking fuel instead of the smoke-emitting chulas through Ujjwala scheme, or the National Nutrition Mission, which is fulfilling the needs of balanced nutrition for women and children. Initiatives like reducing the carbon emission, investing in renewable energy, are campaigns to promote the Fit India movement, Eat Right India movement, promotion of yoga, which is being adopted by so many countries around the world. All these are efforts which are also intended to take us closer towards preventive health. Because I said earlier that our approach towards healthcare has transformed completely. So health does not mean just curing diseases. It means the first step is to prevent a disease. And these are steps because we believe in a whole of government approach. So all the ministries under Government of India are today working together to make sure that we see a healthier and a stronger India by 2047. My dear friends, we know that India accounts for 17% of the world's population. And we have 20% of the global disease burden. We just don't have huge population, we also have huge diversity. So how to bridge that gap and how to address the health inequities that persist in our society? And one powerful instrument to achieve that could be the new technologies. It has the potential to cater to our diverse needs, and India has been one of the preeminent nations in adopting technological solutions and digital innovations to promote the well-being of all its citizens. So one after the other, several initiatives have been taken. Ayushman Bharat Digital Mission is one such laudable effort. So today we are trying to create a digital health ecosystem, creating a unique ID for every citizen of this country. And you would be happy to know that so far, after the launch of Ayushman Bharat Digital Mission, we've been able to generate 81 crore unique Aabha IDs. And of that 81, 73 crore citizens have linked their medical histories or medical data with the accounts that have been created over Aabha. Aabha, along with the other digital innovations like the National Telemedicine Service, which is called eSanjeevani, and which you know played a very crucial role during COVID. The Telemanas, which is our tele-mental health service, that kind of support system. We have created 53 Telemanas cells across our medical colleges and tertiary health facilities today. The CoWIN app and the UWIN portal, which is helping us track every vaccination session of a pregnant woman or a child in this country. These are technological interventions, these are innovations which are helping us shape the healthcare of this country and address the unique challenges of our nation. And you may also be reading about how we have now introduced medical drones. Prime Minister of India, Narendra Modi ji, himself started the medical drone service in 11 All India Institute of Medical Sciences. And we all know the utility of these medical drones in carrying the medical supplies in the hard-to-reach areas. How it is affecting the healthcare delivery. And artificial intelligence, which is also something that Government of India, Ministry of Health and Family Welfare has been trying to adopt in its spirit. Today we have created 3 centers of excellence. One at All India Institute of Medical Sciences, Delhi, the other at All India Institute of Medical Sciences, Rishikesh, and also at PGI, Chandigarh. And we are working on how we can develop, use these AI solutions for making healthcare delivery better and more patient-centric. So a lot of work is going on in that direction as well. I would also like to mention about how we are moving ahead in research and innovation, where the leadership of the Department of Health Research and ICMR needs to be acknowledged. Through their extramural program and intramural program, ICMR DHR has been able to come up with many such solutions which are able to address, not just address the critical health challenges of this country, but also position India as a leader in biomedical research and innovation. And I'm happy to mention to you that ICMR and DHR, they are also playing a very important role today in developing indigenous and affordable health technologies through various programs. They are running programs like the First in the World Challenge. So any new technology which has not been attempted so far globally, that kind of challenge we've started. Frontier Tech, setting up centers of excellence at IITs and MedTech Mitra, wherein we handhold these startups and innovators in coming up with new health technologies and introducing them, taking them to the markets. So we prevent them from all those different valleys of death through this MedTech Mitra. So these are various initiatives of the DHR and ICMR, which are helping us take research from lab to the society. And my dear friends, the pandemic has also taught us that it is extremely important to remain self-reliant when it comes to drugs and also medical devices. So after facing the pandemic, we are compelled to think that we can no longer be dependent on any other country when it comes to our supply of drugs or vaccines or medical devices. And especially medical devices, where we have been dependent on other countries. So Government of India came up with this PLI scheme, which is specifically meant for the medical devices. And today I'm happy to say that many such medical devices, which earlier we used to import from the other countries, the CT scans, the MRI machines, the mammography machines, all that is being produced in our own country today. That is what we have done in these 11 years. There are schemes to strengthen the medical devices sector. There are schemes to grow medical devices parks in India. And also PLI schemes for drugs, for APIs, especially the bulk drugs and APIs. We want to domestically produce all those APIs and bulk drugs for which we are heavily import dependent. And many of such projects have already commissioned. We also have another PLI scheme to domestically manufacture other drugs, the high value medicines and other bulk drugs which are required, the in vitro diagnostics. There are bulk drug parks also which are coming up in the country today. So there is everything that Government of India is trying to take care of under the leadership of Prime Minister Narendra Modi ji. So we are able to attain our goal of universal health coverage, which is the core principle guiding the national health policy. But in conclusion, I would only say that health is a shared mission. And government's efforts alone are never sufficient. We're trying to do everything. But what we need everyone here to understand is that it becomes a collective responsibility. And what we need is stronger partnerships. We need great networking, collaborations. We need everybody's effort. Because it is the power of synergy which will help us realize the big dream, the big vision that we have for creating a Swasth Bharat, a Viksit Bharat by 2047. So with this, I once again thank you all for your audience, and I thank Times Network for having me here and giving me this opportunity to share some of our achievements and our roadmap, of course, for building a healthier nation when we envision a developed India as we complete 100 years of our freedom. Thank you very much.
What inspiring words from the Honourable Minister. And to the Honourable Minister, we ask that you please kindly remain with us on stage for a few moments longer. We at the Times Network would like to felicitate you with a small token of our appreciation. Rohit, I ask that you please do the honours. And a huge round of applause once more for the Honourable Minister for sharing that inspiring vision and mission. A token of our appreciation from the Times Network, ma'am. Thank you for being here and for gracing the occasion. Here at the second edition of the India Health Summit and Awards 2025, ladies and gentlemen. Thank you once again. All right, and with that, ladies and